Hello, everybody. Everyone can hear me? A thumbs up if you can hear me clearly. Yeah, awesome. Thank you, Mirta. Thank you. Okay. Hello, I'm Amir. Welcome to the Everything About ADAT session. Today I'm gonna hosting this event, and yeah, thank you for all thumbs up in the chat as well. So yeah, we're gonna have an exciting, amazing event today. We're gonna have lots of good conversations about one of the demanding topics these days about dentistry education and also the equivalency process. So I'm gonna introduce the presenter. You might know, like many of you know, that Dr. Bahador, the second year Prosthodontics Resident at NSU University, South Florida, and he gonna cover everything about ADAT briefly, and he's going to answer all the previous questions that you asked through the last week in our other media, social media channels, and also we're gonna have an open panel for everybody in this call to ask their questions to Dr. Bahador. And yeah, try to get as much as possible and also give him a hard time because yeah, he is the best person that can answer these questions. So ask a lot of questions, make this session so busy. And yeah, after lots of experiences as a head of instructors of ADAT, he will be here to answer all the concerns. So I don't want to get much time. I'm gonna invite Dr. Bahador to the call to start the session, and I'm honored to be with you guys and hosting this event. I wish you all the best. I wish you get what you're looking for out of it, and we're gonna have such events soon, so stay tuned with our social media and other websites and everything that you can, or come to the office, and you're more than welcome to visit for those who are reside in Toronto. And yeah, let's jump into the session. Wish you all the best. Have a great day, guys.
Hello, everyone. I hope you're good. I'm really happy being with you today. So we can talk about the ADAT exam. I've received some of your questions. So I think for today, it's better to go briefly over what is ADAT exam about. And then I'm gonna open the panel so you can ask your questions in live session. And at the end, I'm going to talk about a little bit about the dental schools in the United States, if anyone is interested. And I'm going to talk about the new course that we are launching in Confidentist about ADAT, because I've heard that there has been so many confusions about the ADAT course in Confidentist. So I was talking with Dr. Mehdi yesterday, and we decided to just make it really simple for you, so you can choose whatever you need based on your requirements. So I'm going to talk a little bit about ADAT. As you know, I have a video in Confidentist YouTube channel, so you can go and watch that video. I've explained everything there, but for now, I'm going to just talk about briefly about the ADAT. In a short time, I don't want to waste time on that much. You should know about that. So then I want to just give you the time to have your questions. So let's just get started about the ADAT exam. As you know, ADAT exam stands for Advanced Dental Admission Test. So this exam basically in the United States is a kind of exam for postgraduate students. So the dental students in the United States in the last year of product take this exam to apply for some residency program in the United States, like oral maxillofacial or orthodontics, even pros, perio, or endo. They don't need ADAT. So ADAT is a very specific exam, and it's a very comprehensive exam. which is held in United States. But as you know, University of Toronto, University of McGill, and I've heard recently that Saskatchewan and Manitoba are just turning into ADAT instead of AFK, which is, for me, it's too much for advanced placement programs, but it is what it is. So if you want to go for universities, I can tell you based what we are seeing right now, all the universities are going to switch to ADAT. So that's the future for any applicants who want to apply for Canadian dental schools. So as you may know, ADAT exam consists of 200 questions. And these 200 questions are divided in 3 different parts. The first part is about biomedical science, which consists of 80 questions. The second part is the clinical science, again, 80 questions in this part. And the last part of the exam is data research interpretation and evidence-based dentistry, which consists of 40 questions. So if you check the ADAT guide, which is published by ADA, it's explained everything there about the topics that's going to be covered in the exam. But briefly, for biomedical science, it consists of 4 separate 20 questions. The first 20 questions comes from anatomic science. The second 20 questions comes from biochemistry and physiology, and the next 20 questions come from microbiology and pathology, and the last one comes from dental anatomy and occlusion. If you want to know about the clinical science part, which is again 80 questions, it consists of endodontics, operative dentistry, oral and maxillofacial surgery, oral diagnosis, orthodontics, pediatrics, periodontics, pharmacology, and the principles of ethics and patient management. And the last part, which consists of the last 40 questions of the exam, is about data research interpretation and evidence-based dentistry. So if you go to the ADA website, you can find the ADAT guide. It's explained everything there, so you can check it and have enough information about that. Regard to questions that you may face in the exam, we have different type of questions in the ADAT. The first type of question that you may see in your exam is called simple questions or standalone questions. These type of questions are simply a question with multiple choices. We have the other type of questions in this exam. They consist of some charts or some radiographs from one patient. So they can be, again, standalone, or they can be case-based scenario, which means you may have a patient, so you will have a chart of a patient with radiographs, photographs, and so many information. And then you may have 3 to 5 questions about the same patient. Another aspect that is really important to know is when you are taking the dental exams in the United States, the tooth numbering system is different from what you can see in other places. So they use the tooth numbering from 1 to 32. So any tooth has a specific number that allocated to that tooth. So it's not like 2-digit tooth numbering that many of you may use to that. The first digit just corresponds to the quadrant, and the second number shows the tooth in each quadrant. But in United States exam, like ADAT or INBDE, you should prepare for that. So it's a little bit tricky at first. You should just get used to that, because any tooth has specific numbers. So you should be very quick to recognize any tooth, and by some practice, you will be fine in that. So it's good to know about that. Regard to timing of the exam, ADAT is 4 hours and 30 minutes. As I told you, you have 80 questions in biomedical science. You can answer all the questions in 95 minutes. And in clinical science part, which consists of, again, 80 questions, you can answer all the questions in 90 minutes. And the last part, for data research interpretation and evidence-based dentistry, you'll have 45 minutes. You can find some ADAT practice questions in ADA website. They have not changed it for a while, and I don't think that they're going to change it. So it's just to help you get familiar with the type of questions and what's going on in the exam. As you know, ADAT is not like INBDE. INBDE is a different exam which is held in the United States, so it's a pass and fail exam. But for ADAT, you will have a score, and the score would be between 200 to 80 to 800. Based what they are saying in their website, if you get the score of 500 or above, it's considered standard score. But as you know, in Canada, the competition is so high, so I can't give you a number for a score that you have to aim to. It's better to get as much as you can. When you receive your score for ADAT, they're gonna send you 4 separated scores. You will get 1 score for biomedical science, 1 score for clinical science, 1 score for data research, and an overall score for the whole exam. And they're gonna provide you some charts that shows you where you're standing among other participants in that exam. In ADAT, scores goes in increments of 10. So it will show you that on what percentile you're standing among other applicants. So any institute can use these statistical methods to just interpret different participants that are applying to their institute. One thing that I've seen that there's so many questions coming from is the application requirements for ADATs. Because many of us are coming from non-accredited universities, so we need to take some steps to be eligible to take the ADAT exam. The first step is getting DENT. DENT PIN is 8-digit number that you can go to the ADA website, and it's really easy to get this number. You just fill out the form, they will provide you this number. As soon as you have this number, you can move forward to the second step. The second step is you have to send your transcripts or your educational documents to ECE. ECE is Educational Credential Evaluators. It's an institute located in Milwaukee, in the United States. You have 2 options. You can send your original documents from your school to ECE, or you can send the notarized one to them and ask them to send the transcripts of the translation of your transcripts into the ADA electronically. So you will apply to ECE. And one important thing to know is when you're applying to ECE, for sure go for course by course transcript, because you can choose different options. It's better to get the course by course. As soon as ECE receives your application, they're gonna process your application and they're gonna send your transcripts into the ADA. After that, ADA is gonna send you an email saying that you are eligible to take the ADAT exam. And they will give you a period of 30 days. But nothing to be worried, because if you schedule your exam, you can change your schedule after that. So it's not like that. If they say that you have a period of 30 days, you have to take your exam within 30 days. It's flexible. You can change it even 24 hours before your exam. So after ADA sends you the email for eligibility to take the to take the ADAT, the next step is they're gonna refer you to Pearson VUE centers. Pearson VUE centers are some specific centers like Prometrics that they hold different type of exams like board exams and ADAT and exams like that. So ADA is gonna send you a confirmation number, so you can use that confirmation number, go to BUE Pearson website and schedule your exam. So you can take your exam, and after that, they're gonna send your results into ADA Pass or any institute that you choose it. So you can choose, whenever you are registering your ADAT, you can choose where you need your results to be sent. Another aspect about ADAT is the eligibility period in each year. As you know, ADAT is not like INBDE. INBDE is a kind of rolling exam, so it's being held all through the year. But for ADAT, we have a period of 6 months in each year that you can take the exam. This period starts from March 1st to August 31st of each year. So you can apply for your exam during this period, and you can take your exam. Now, if you take your exam and your result came out and you're not happy with that, you can go for your second attempt in the same cycle after 45 days of your first attempt. But if you want to go for your third attempt, your chance would be just once in a year. So you have to wait for the next cycle, and you have just one chance in a year. So to summarize everything, for non-accredited students or dentists, the first step is getting dent pin. The second step is going for ECE, and the last step is scheduling exam through Pearson VUE centers to take your exam. I think that's enough for now. I've explained everything in my videos. I don't want to waste time on that. I just tried to talk about a little bit about ADAT, different aspects of ADAT. I want to just hear your questions, because I've heard that there has been a lot of confusion about the ADAT. So I want to try to help and answer all your questions. I think we can move forward. Anyone has a question can use the hand sign so I can answer your questions. So one of you is asking that, can I book for the exam now for upcoming March exam? I don't think so. For each cycle, you have to wait for that cycle to start it and then schedule. So if you are in this cycle, you have to wait to this cycle be ended, and then you can start for the next cycle. And you have to apply again. So the question is, how many times can we appear for the ADAT test? As I told you, there is not limitation, but for the first and second attempt, you can go in one cycle within 45 days, and after that, you have just one chance in each cycle. Are some universities still accepting AFK, or will they all move to ADAT? For now, as I've seen, University of Toronto, McGill, Saskatchewan, and one part of admission for Manitoba is switched to ADAT. So I think the future would be ADAT. So you have to consider ADAT for your future. Which universities accept ADAT score for admission in the US? As I told you, ADAT in the United States is for residency application, and not all residencies require you to take ADAT. It's more about the ortho, oral, maxillofacial, and some other residencies like that. So there is no need to take ADAT for advanced placement programs in the United States. And if you want to go for advanced placement programs in the United States, you have to take the other exam, which is INBDE. I will talk about that. Now my focus is on ADAT for Canada. Isn't ADAT used for admission in American universities for placement? As I told you, ADAT is not a must to get admission in universities in United States. I mean for advanced placement, not for residency. For residency, it's better to take ADAT. Can general dentists apply for ADAT? For sure. Any general dentist can apply for ADAT. As long as you have your educational documents, you can. You have to just send your documents to ECE. You have to get your dent in, and then you will be eligible. As I told you, I'm not sure that you can register now on book exam for the next cycle. As I know, if you are not happy with your exam for the first attempt, for the second attempt, you have to apply again. But about the changing the cycles, I'm not sure. But I think it's not possible. You have to apply again next year. Can we only give ADAT exam once a year? For sure. I applied for ECE last week, but I opted for general report. It's not gonna cause issue, but it's better to be course by course. I think you can ask them to change it into course by course. Can we only give ADAT exam once a year? I told you, yeah, you can. You can have your first and second attempt in 1 year. After that, you have just one chance in a year. Do you know if the ECE verification expires if I sent my documents more than 5 years ago for another exam? Are they still valid? I think they're still valid. I applied for ECE last week, but I opted for general report. As I told you, you can contact ECE and ask them to have the course by course. Are 15 days enough to go through the extra? No, 15 days is not enough for sure. I will talk about that. How much time I will take for the transcripts and referral from the US? I would say with ECE, maybe 3 weeks to 4 weeks would be enough if you send your documents. It says general report on the ADAT guide. Can you please confirm? The problem is for universities in the United States, they're not going to accept your ECE as a general report. So they're going to ask for course by course. I think it's better to be safe to have the course by course for universities in Canada as well. That's the reason that I'm asking for course by course. For how much time the pre-recorded sessions are available for ADAT if registered now? I will talk about this. We are going to give you some time for each video that you are having from us. I have AFK next month and followed by ADAT. I need to talk about this. I will explain about AFK and ADAT and what is the difference between these two exams. So is ADAT knockout would be similar to main ADAT exam? Is that useful at least for the knowledge part? Yeah, for sure. I will talk about that. When should I start registering ADAT system to get into the exam in 2024? So you have to wait for the next cycle. I was just reading instructions for University of Manitoba, and they were asking, they want your ADAT for the March 1st. So I was just wondering, maybe you have to clear your ADAT for this cycle to apply for the next cycle, based on what I've seen in their website. So you can check it there. Any particular resource to trust? For ADAT, ADAT is a very extensive exam. So there is no end to what you can study for that. So to me, it's really important to be wise when you're studying for an exam like ADAT, because you have to cover so many topics and the amount of question is really low. So it's just 200 questions. So that's why I think they are considering if you get 500 out of 800, you're fine. For how long is ADAT results valuable? As I've seen in dental universities in Canada, I think they are considering for 3 years, as I've seen. Does giving second attempt affect our application? One important thing about this question, remember, I told you the first step to take your ADAT is getting dent. As soon as you have your dent in any dental exam you take in the United States, it's going to be attached to your denting. So whenever you apply to any program in the United States or Canada, all the history of your exams would be sent to your university that you are applying for. So for me, it's better to go for this kind of exams whenever you are totally ready and clear it just in the first attempt, and don't go for the second one, specifically in Canada because of the amount of competition. Go for that exam whenever you are ready and clear it with the best score. I can't guarantee anything because ADAT is not the whole process of your application. So there are so many factors they are considering, and one of the factors that they are considering is your ADAT score. So many of students ask me that what is the good score for ADAT? You know, it's not about your score, because in any exam you participate, what's happening is they're gonna check your score and compare it with other participants, which means you may have, I don't know, 550 in one exam, but you are in a better percentile that the other ADAT exam that someone has got 580. So it doesn't work like that. So you can't be just stick to the numbers. It's about statistical methods. As I told you, when you receive your score, it's not like what you can see in other exams. It's going to be so many graphs and charts, and it gives you just a kind of increments and shows in what percentile of the population of participants you are standing. That's the most important thing. So I can't give you a number. For me, myself, I got 660 and I was above the 10 top percentile. But I'm not sure if you take the other exam, because one of the other aspects of ADAT is some of the questions in the ADAT doesn't have any score, and you don't know what questions are there. So there are so many complicated stuff in this exam. You have to just be prepared for this exam as much as you can and go and take it, and do not overthink about that. For now, will internationally trained dentists give ADAT exam study in Canadian universities? As I told you, University of Toronto, McGill, Saskatchewan, and recently I've seen in one of these for application for Manitoba, they are considering ADAT. I think within next year's all the universities in Canada are gonna use ADAT instead of AFK. There is no negative marking in this exam. If you participate in this exam and for example, you can't finish the exam, the lowest score that you're gonna get is 200. You cannot get any score less than 200 in this exam. So I don't know what you mean by negative, but regard to scoring, that's how it works. For preparation for this exam, is the clinical science part similar to AFK material? Exactly, I will talk about that. And we have a good plan for you guys. It says, apart from ADAT score, who checks to get admission in university? There are so many factors: your clinical experience, your research experience, your North American experience, your score in English language. There are so many factors can just help you. Your GPA, one of the reasons that you are sending your transcripts to ECE is getting the equivalence of your GPA. So they're gonna change your scores into US GPA from 0 to 4. Also, what about biomedical science and literature part? I will talk about that. Let me see, I'll answer all the questions. Can you a decent GPA for Canada? I would say as much as you can. For US, as long as you are over 3.5, you're fine. That's a good GPA for dental schools in the United States. But for Canada, you know, because of the competition, it's better as much as it can. Okay, let me just talk about ADAT, AFK, and INBDE. And I can back to your questions again. I don't see any new questions. Let me just use the time. I want to give you enough information in this short time. So my first advice is have a good strategy. Think about your strategy. Are you gonna do you want just apply for the universities in Canada, or your final goal is just in Canada, or are you considering US as an alternative? Because US is a huge opportunity for Canadians. I don't know why, but I don't see anybody in Canada that have enough information about the dental schools in the United States, and I had a hard time during the time I was applying for the universities in the United States. Before talking about that, I want to talk about those students that just thinking about having option in Canada. I would tell, have plan A and B at the same time. I know that ADAT exam is just going up and it's going to be the future for universities, but you have to take AFK and you have to go through the dental equivalency process at the same time. Don't wait for one way to just you get fail and get frustrated and go back and start to go to the other way. Try to move in a parallel way in both ways. Don't waste your time. And regard to AFK and ADAT, as I mentioned in my answer to one of you, AFK material can cover the clinical part of the ADAT. As I told you, ADAT has 3 separate parts. The first part is biomedical science. The second part is the clinical science. And the third part is the dental research and evidence-based dentistry. So if you prepare for your AFK, you already cleared 80 questions of ADAT. So it's a good news for those who have passed the AFK, or at least they have studied for AFK. So for those who have passed AFK or who have studied AFK, they need to just study about the biomedical science part of the ADAT and for data and research and evidence-based dentistry. What I've done in Confidentist is I've provided some brief booklets for both biomedical science and research-based dentistry. If you go through the ADAT guide, which is published by ADA, for any of topics in biomedical science, like biochemistry, physiology, pathology, microbiology, or whatever is there, there are some subtopics that they have mentioned. The booklets that I've prepared for students is just exactly the same as the topics they have provided in their guide. And I try to just make it as short as I can. So I would say if you study hard, you can clear the biomedical science part of my booklets in 2 or 3 months. And I've provided a booklet for the research and evidence-based dentistry with recorded sessions. It's just 4 recorded sessions. It's really brief. So you can go over that. It can really help you. For those of you who has studied for AFK or who has cleared AFK, you need to just take the biomedical science part and the research part, which is already in Confidentist. They are all instructed by myself. There are some recorded videos, so you can contact Confidentist, use those. And I can tell you, you can clear everything within 3 to 4 months if you study hard. And you have studied for AFK, so you can take your ADAT exam. Now I'm going to talk about the other applicants who are considering to apply for the dental schools in the United States. For those who want to have an option to go for dental schools in the United States, we have the other exam in the United States. It's called INBDE. INBDE is an exam which is holding during the year. It's like a rolling, so it's not like ADAT. You can take this exam whenever you want. As long as you have your dent in and you have sent your ECE to ADA, you can apply for INBDE exam. Good point is, whoever takes the ADAT exam can clear INBDE exam as well, because INBDE exam consists of biomedical science and clinical science, which is already covered by studying ADAT. What I mean is, if you're taking your ADAT, you can clear your AFK, and at the same time, you can clear your INBDE. So my advice is, for whoever wants to consider dental schools in the United States, it's better. After you pass or you took your ADAT, go for your INBDE within 1 month and clear that exam. The good point about INBDE is this exam is just pass and fail. So you can pass it for sure. If you are prepared for ADAT, for sure you can pass your INBDE. So if you pass your INBDE, and at the same time you have your ADAT, that's an extra thing that you have, because other applicants in the United States don't take ADAT. And if you go to some of the universities' websites in United States, they say that we don't need ADAT, but if you have ADAT, we will consider it, which means it can make a huge difference for you between other applicants. So you will have a high chance to get in one of the advanced placement programs in the United States. So my advice is, for those who want to just consider working on Canada, it's better to clear ADAT and AFK at the same time. And for those who wants to go for dental schools in the United States, it's better to take INBDE as. ADAT is the most extensive exam, which is just held in United States. And I don't know why universities in Canada has decided to use this exam for advanced placement. But at the same time, I would say that this is an opportunity for you, because by taking this exam, you are ready for all of the other exams. So this is another point. Let me check if we have any other questions. Yes, let me just talk about the plan that we are making in Confidentist. Before that, I tried to make different packages for students, but I've seen that it's brought a lot of confusion between the students. I was talking with Dr. Mehdi yesterday, and we decided to have 3 separate packages for students. The first package is for students who have taken AFK. So they don't need to take the clinical part. So they need just the biomedical science and research. We want to call this course a kind of crash course, so you can take that one. The second course is for students who have not taken AFK, so they have not had any contact with any material of AFK. I was talking with Dr. Mehdi because I'm really busy right now. We are talking with one of the students that has recently cleared the ADAT. That student's gonna help the students that they don't have any idea about AFK, to help them how to study AFK material, because AFK material by itself is too much for ADAT. So we can summarize some of that, and we are going to do that for those students that have not participated in the AFK course. So they can use the same material, but we will just guide them to how to study AFK material for ADAT. And at the same time, they can have the biomedical science and research part of our course. And the third package would be the mock exams. We already have 2 mock exams. I'm thinking to add 1 more mock exam for the students. I think that would be more than enough. So with these 3 packages, I think anyone can have whatever he or she needs. So I will talk with Dr. Mehdi again. We will launch these courses as soon as possible. I'm really sorry, I'm really busy these days, but we are adding some other stuff to our ADAT course to just help the students get through this exam. So let me check if we have any other questions. Some of you has sent that you have tried to contact me through my Instagram or my Facebook. I think the best way to reach me out is through my email. So my email is my name, Amir Reza, without any space, with 2 R's, amirreza.bahador@gmail.com. So if you had any questions, you can just send me an email. I'll back to you through my email. I think that's the best way to contact me if you need me. I have on August 29. So how do I modify my AFK material for preparation? So you have your ADAT exam on August 29. So how do I modify my AFK material for preparation? I don't know. Have you taken your AFK before? This question is not clear to me. If AFK results also shared along with ADAT when applying for Canadian university? I don't think so. For the universities that are considering ADAT right now, they're not going to consider AFK. So they don't care about your AFK score. Any information? For information about universities of Canada, I think Dr. Sina would be the best option. So he's the guy that you can get help from. I would be really happy if I can help you with the dental schools in the United States, because you have a really high chance to get in dental schools in the United States. We have University of Buffalo, we have University of Boston. University of Boston by itself gets almost 80 to 90 students in each cycle. It's not comparable from what we have in Canada. If you just check all the universities in Canada, I think it's less than that. So you have so many opportunities in the United States. And the good point about advanced placement programs is, if you get into one of these programs, you will be a US dentist, so you can work in all states in the United States, and at the same time, you can back to Canada, take the board, and work as a dentist in Canada. So you will have so many options. I need to study everything from FK competency or focus on some portions. As I told you, for those of you that have not studied AFK yet, I was talking with Dr. Mehdi, so we are involving one student to help you out to how to just summarize the AFK material, because that's too much. I want to help you to have just less material and put your focus on everything that you need for your ADATs. Should be before applying to US dental. What is that? Preceptorship before applying to US dental schools. I don't know what you mean by preceptorship. Let me check. Your question is not clear to me. You can apply for all the dental schools in the United States. There is no limitations. Some of dental schools just actually give acceptance to US citizens, but so many of universities in the United States have opportunity for international dentists. No, you don't need to have observership as long as you have enough clinical experience, and you have a kind of research experience or any shadowing experience in North America. It will be helpful for you. This is a package. When you apply for the university, it's a package. It's your GPA, it's your English language score, it's your clinical experience, is your research experience, and your INBDE passing, and if you have ADAT, your ADAT score, and where you are standing among other participants. So it's a whole process. It's not just one part that will be considered. So one of the students says, I feel I don't have enough time to cover everything. I don't know where you're standing. I don't know what you have studied. So I can't tell anything, but now we are in July. We have just August. So to me, if you are not well prepared for ADAT, don't go for that. Be prepared for that, and just do this exam once and get your best score. I think this is the best. By the way, having the second exam can be a kind of negative point. I would not say for sure, but you know what? Psychologically, you will feel just better, you know, because I cleared this exam in the first attempt and my score was fine, you know. But I know many students in dental schools in the United States that have not cleared the exam in the first time. What do you recommend? The best pathway would be to keep all my options open. First AFK, second INBDE, third ADAT. That's a wise decision. Yeah, you can go step by step. So if you go for AFK, you are studying for clinical part, then you can take your INBDE, you will add the biomedical science, and at the end you can add the research and go for ADAT. That's a wise decision. I like it. Yeah. Yeah, the email is correct. amirreza.bahador@gmail.com. Is AFK results also shared along with ADAT when applying for Canadian universities? I don't think so. For the universities that are not considering AFK, they don't care about AFK anymore. They are asking for ADAT. I have not taken my AFK exam before, and ADAT is the first exam that I'm taking. When you say the material is little extra for profession, so do I need to study everything from AFK material? As I told you, for those who have not taken AFK, we are in process of involving one student to help you out to summarize the AFK material for you just for ADAT. So you can save your time and use your time for the other part of the exam. But for those who have passed AFK, so you have already studied about the AFK. So you are prepared for that clinical part. You need just a review over that. So someone asks which university. I don't know what you mean by which university. I didn't clear my MBDE part 1, but I want to give. Not at all. Don't think about that. If you have failed your part 1, that's fine. Go for INBDE and your ADAT, you'll be fine. As long as we are talking about dental schools in the United States, you are fine. Just do it. For US dental schools, do we need co-signers for loans? Yeah. So the only thing about the dental schools in the United States is the only option that you have if you want to go with a loan, the only option is go for a private loan, and for private loan you will need a co-signer, and the co-signer should be a green card holder or a citizen of United States. So if you have someone like that, consider it an option for sure. It is worth it. If I get into residency program, then I would be allowed to work as a specialist in America and Canada both. You're asking about my situation. So I got acceptance into specialty program. I'm the second year resident in prosthodontics at Nova Southeastern University right now. So after my graduation, I can work in 11 states of the United States as a prosthodontist. And for Canada, I think I don't consider to come back to Canada, but if you want to come back to Canada, I think there are some ways you can get some exams and you can back to Canada, but I would say it's not a wise option. If you can't be a specialist in the United States, it's better to stay here and work here, but it's up to you. INBDE is scored is no, INBDE is just pass and fail. So if you clear your ADAT, I would say take your INBDE as soon as you can. So you will be passed for sure. It's not that much complicated, you know. I've been through all the exams in Canada and in United States, and I would tell you that in the US exams, everything is really straightforward. As long as you study, you're fine. You will pass and nothing else. But you know that in Canada, sometimes, you know, there are huge changes and, you know, so many stresses like that, but this is not the case in the United States. So based on my experience, because I've passed AFK, ACJ, I've taken part 1 in US, part 2, and ADAT. So I would say exams in the United States are really more straightforward. It doesn't mean that you don't have to study, you have to study for sure, but they are more straightforward. My BDS percentage. My BDS percentage is 75. I don't know what you mean by BDS percentage. What I know is about GPA. As long as your GPA is over 3.5, that's a good point. So if you go less than that, you have to compensate with other things in your application. If I get admission in placement programs in Canada and after graduating, can I work in America? Yeah, you can. You have to take the board. Yeah. Dental schools are accredited in United States. And again, US dentals are accredited in Canada. So you have to just take the board. You can, yeah. Advanced placement programs has the opportunity for you that you can move whenever you want. Yeah. But dental equivalency process is just for Canada. So you can move to US. Okay, I think we answered so many questions. If you had any other questions, send me an email. I will try to back to you as soon as I can. I hope all the information that I provided to you has been useful. I will talk with Dr. Mehdi this week, and we will announce our new courses soon. Because now ADAT is just getting more important. I think we need to help students to just get through these exams. So that was really nice talking with you guys. I hope you will pass your exams. I will tell you that just don't give up. Try hard. I've been through a lot to get the position that I'm right now. So one aspect that is really important for me myself is I really love to help people. So if you have any question, I will be really happy to help. You can reach me out through my email. If you consider, specifically if you consider to apply for the universities in the United States, I would be really happy to help you, because I know there are so many confusions about that and no one knows anything. I remember that at the time I was applying for the US dental schools, I didn't have anyone to help me and it was really hard. And I was thinking that if it worked for me, I want to help others to get through this. So ask me any questions and I will try to help. When do the universities start accepting candidates for placement, also residencies? It's already started. It's almost getting finished. If you are considering for dental schools in the United States, you have a chance for Boston University because the period closed on December. And we have VCU in Virginia that extends till next February. These two universities are the only universities that you have a chance right now if you clear your INBDE exam. If we apply to loan from Canadian bank for university, do they know? No, Canadian banks are not going to provide you anything for the US schools. The only option for Canadians to get loan in the US is just private loan with a US citizen co-signer. That's the only option. Don't count on banks in Canada or US. It's just a private loan that you can go for that. Yeah, okay. I think we answered all the questions. I hope you will be successful in your process. Take care. And goodbye, everyone. Have a great day.